Hi, and welcome to Do It Yourself Diabetes. This is Catherine O'Grady,
Andrea Shaver,
and we're with the Department of Nursing at Wichita State University. One of the first things we want to show you is how to check blood glucose, which is important in the management of diabetes.
Hi, I'm Drea, and I'm going to show you how to test your blood sugar when you're at home, okay? So, the first thing you want to make sure is that your hands are nice and clean and dry. When you're in the hospital or you're at your doctor's office, they probably will use like an alcohol swab and wipe off the side of your finger. You can do that when you're at home as well if you'd like, but biggest thing is just to make sure there's not any lotion or anything sticky like food or juice or anything on your fingers that might make your blood sugar reading inaccurate. So, I'm going to show you how to use my supplies. Your supplies might look and work just slightly differently. If you need to, you can always refer to the instruction manual that comes with your supplies or their website. So, for my glucometer, I'm going to open up my bottle of test strips, grab a test strip out, and then I'm going to insert it in the end of the glucometer here and wait for it to turn on. The instructions on the screen, so it says to apply the blood. So for that, I'm going to take my lancing device here. Inside the lancing device is a lancet. I'll show you what that looks like here. Just a teeny tiny needle in there that'll help kind of get a little dot of blood on your finger. So I'm going to pull back here, and then I'm going to pick a finger and just kind of poke the side of my finger. 1, 2, 3. And then a little dot of blood will appear. If you're having a hard time getting the blood out, you can kind of squish your fingers up there a little bit to get it to come out a little better, but that's plenty of blood for a test strip. So I'm going to follow the instructions and just touch the end of the test strip to the dot of blood here. And that's it. So we'll wait for our reading to come up on the screen. All right, and then based on that reading, we will treat it appropriately. So now that you know how to check your blood glucose, let's talk about interpreting the values. So typically, in a person without diabetes, the normal range of blood sugar is 70 to 100. Anything below 70 is considered hypoglycemia, or low blood sugar, and anything above 100 is considered hyperglycemia, or high blood sugar.
As we mentioned, hypoglycemia is less than 70 on your blood glucose monitor. If this is left untreated, it can lead to severe and dangerous cases, including death. Some causes for hypoglycemia include consuming excess alcohol, skipping meals or eating less than usual to counteract your need for glucose in your blood, increased physical activity without enough nutrition, and problems with medications, such as using too much insulin.
While it's important for any person with diabetes to know how to check their blood glucose at home, it's really important for people taking insulin, sulfonylureas, or meglitinides to know how to check a blood glucose because these medications increase your risk of hypoglycemia. There are some brand names listed on this slide in case you don't recognize your medication.
Signs of hypoglycemia can include nausea, dizziness, rapid heart rate, sweating or chills, and irritability. Those are more early signs of hypoglycemia. When these are left untreated, these signs can progress until a person is experiencing blurred vision, problems with their coordination, facial numbness or tingling, pale skin tone, and even seizures or confusion. Up next, we have a video that shows what signs of hypoglycemia may look like.
Nauseous, super shaky, my heart's pounding. I think I need to check my blood sugar.
Wow, 48? That was my blood sugar? No wonder I was having a hard time. I need to treat this right away. I'm going to use the 15-15 rule and eat 15 grams of carbs and recheck in 15 minutes. Good thing I always carry my fruit snacks in my pocket. These fruit snacks, we can read the nutrition label and we can see that the total carbohydrates is 17 grams. That's just a little bit more than the 15 that I need. So I'm going to eat almost this whole package and then recheck, maybe just not the last one, and then recheck my blood sugar in 15 minutes. In treating hypoglycemia, a good rule is the 15-15 rule. Like we showed in the video, you can take 15 grams of carbohydrates and then recheck blood glucose in 15 minutes. If this is still low, less than 70, you can have another 15 grams of carbs and recheck again. Continue until you're at a normal glucose level.
Like with hypoglycemia, it's important to recognize the signs of hyperglycemia as well. Some of the early signs of hyperglycemia are excessive thirst and frequent urination. Hyperglycemia isn't typically as much of an immediate emergency as hypoglycemia, but severe hyperglycemia can result in serious problems like diabetic ketoacidosis or hyperosmolar hyperglycemic syndrome. It's important to follow your doctor's instructions for treating your hyperglycemia and your own diabetes, because everybody's a little bit different. Your doctor should set individual parameters with you for the treatment of hyperglycemia and when they want you to notify them about your hyperglycemia. For some people, your doctor may give you tests that check for ketones in your urine that you can use at home. This is another sign that you want to tell your doctor about right away if this test is positive. One thing that people with diabetes often ask is, what can I eat? Your diet's a really important part of managing diabetes, so we've listed some helpful examples here for you. A couple of things that might be nice to carry around with you in your purse or backpack are fruit snacks or fruit leather strips, peanut butter crackers, or something with a lot of protein like beef jerky or a meat stick. The fruit snacks or fruit leather strips are a really good option to help raise your blood glucose quickly in case you have hypoglycemia. It's important to carry around something that can raise your blood glucose if you are at risk of hypoglycemia. Peanut butter crackers are another good option because they have both carbohydrates and protein in them. And then beef jerky or meat sticks are good because they're pretty much just protein and they don't typically have a lot of carbohydrates in them, so they won't really affect your blood sugar too much.
So, are you craving a cheeseburger and fries? Well, one healthy option for this could be to substitute your bun for a lettuce wrap and substitute your fries for a baked potato. This means lower carbs, which reduces the amount of insulin that you need to take, and this has lower fats with it, which lowers your risk for cardiovascular disease and other complications associated with diabetes. If you're looking for local community resources, we recommend going to the diabetes.org, which is the American Diabetes Association. And I'm going to show you here how to find local community resources. Just for diabetes, you can go to the American Diabetes Association, click on Community tab towards the left-hand side of the screen, go to Find Your Local Office, and then you can search by area and state. So here, you can search for Wichita, Kansas, and click on the area, and there's a number to call on this right-hand side of the screen.
Diabetes can feel really overwhelming, but we hope that this video helps to teach you some of the basics for how to manage your own diabetes at home. Hopefully, now you understand how to check your blood glucose, recognizing the signs of hypoglycemia and hyperglycemia, and you understand some of the basics of making good dietary choices to manage your diabetes. Remember, this is a complicated disease and it can be really hard to manage, so make sure you talk to your healthcare provider or diabetes educator about any questions you have related to diabetes, your management, your medications, or anything else.
Here are some extra resources that you can refer to with your questions.
And here are some of the resources that we use to put together this video.